With new technologies, new specialties, and new procedures available right here, more people than ever are making UPMC Hamot their destination for highly specialized care. UPMC Hamot and UPMC. Stronger together.
Hamot was strong before the organization determined they wanted to go down the merger. But there's no question that there was going to be fundamental change in regards to how an organization is going to be positioned into the future. And this board had the foresight to say that we need to be part of a larger organization, and let's pick the right organization to be part of.
It had to do with keeping people here. We do great work, and this work gets done right here in Erie with people from Erie. Our own resources are staying here, and that's part of the $300 million commitment that UPMC made and is living up to.
Since our affiliation, we have spent $123 million in capital that we would not have as an independent hospital. Our revenues are up over 20%. We are the largest provider in northwestern Pennsylvania, and we continue to expand our breadth of services and grow and recruit physicians and staff. We are clearly stronger together with UPMC, and they are stronger together with us, UPMC Hamot.
Over the last 5 years that we've enhanced the in-migration to Hamot, over 15% increase in the number of people coming to Hamot. And that's really indicative of the physicians and the physician specialties that we offer here that we haven't offered in the past, as well as our work with some of our regional hospitals and physicians in the different markets to create more of a partnership with Hamot as well.
Hamot has given us the ability to learn about the northern part of our state. It's helped us gain population with our health plan. It's given our specialists a way of taking care of patients in their own communities by coming up and working side by side with the Hamot doctors, which of course are now UPMC doctors.
On the hospital side, we spent some time evaluating what services that we were going to need to make our surgical services more enhanced. And we looked at things like hepatobiliary surgery. Now that Dr. David Geller is now doing surgery here at Hamot, as well as opening our transplant service here, basically giving an opportunity to those patients in our region who have needed a kidney transplant but have had to travel. So I think those are the kind of opportunities that I think that have been promoted here, as well as executed on by the leadership of this organization in a really proactive way.
Unfortunately, in the United States, we have a huge amount of patients that suffer from hypertension and diabetes, and those are the two leading causes of kidney disease. So with that in mind, and looking at the resources that are available, this was a prime opportunity to set up a transplant program.
The affiliation with UPMC has strengthened our position to recruit physicians to Erie, otherwise that we would not have been able to recruit alone as an independent hospital.
If I step back and look at this would have been unthinkable 15 years ago, but the vision is clearly there to make UPMC Hamot a destination hospital where patients not only from the region but from long distance will fly in or drive in to get their state-of-the-art cancer care here.
When you're talking about working with a physician like David Geller, it's very easy to have him provide services at UPMC Hamot, and from afar he's able to view the patient's medical record, actually look at the patient to see how they're doing through the technologies that we have.
From a professional standpoint, it's very gratifying to know that you're right there, right on the leading edge of what's going on, and getting to see the absolute current state of the art of what's happening and be a part of it. It's tremendous.
Dr. Malaspina and Dr. Dexter and their team, they're in the trenches. They're the front line. They're seeing patients every day. And I learned from them, as well as providing them with some additional training and skill set for advanced liver surgery and for laparoscopic liver surgery. So it's a great partnership.
We're just all together at this point. There's no Hamot and UPMC. Hamot is UPMC.
I've been noticing since we have opened up this building, and just from being a nurse in general for 9 years, our patient population is changing in labor and delivery. The women are sicker, they have hypertensive disorders, they're diabetic, and all these issues that keep laying on top of each other could eventually lead to cardiac arrest. So I spent a couple years doing research with a couple other nurses on our unit, and we came up with a plan to educate our nurses. We wanted just to make sure that we were ready to roll. If this patient were to walk through our doors, we would know what to do.
Joanne and I wanted to be parents, but it was not happening. For a while, I almost think that the two of us thought we would never become parents. And then all of a sudden, here we are the night of our 15th anniversary doing a pregnancy test. She did a pregnancy test on her own, and then she did the one at the doctor's office, and we were both just like, couldn't believe it. You try and you wait and you hope, and then finally it comes true, and we did. We waited a long, long time, and we were both very, very excited. Joanne was facing me, and all of a sudden she basically fell to her side, and I didn't feel a pulse, and then that's when I completely started panicking. And I dialed 911, and very heavy breathing and screaming at the top of my lungs, I'm telling the person, my wife is 35 weeks pregnant, she collapsed. They connected the pads to try to do resuscitation, and the machine was saying stand clear from patient, and then it would say no pulse, no breathing.
I got a call from our triage nurse who said that there's a patient in cardiac arrest. And we ran to the ED, and we got there, and they said she's 7 minutes out. Anything greater than 5 minutes after the cardiac arrest occurs, the baby does not have a good chance of survival. And we prepared for the worst. We brought her into the trauma room. They continued the compressions, and immediately the obstetrician did the bedside cesarean. And the little baby girl was born. I don't remember anything except the NICU team taking over. I kept looking back, I kept looking in her eyes, looking for some sign of life, that her baby was born, and I just wanted her to wake up.
So here, Dr. Jeffers comes in and says, we lost Joanne, I'm so sorry, but we were able to save ESTELLE, and everyone just kind of lost it. I remember looking down on ESTELLE in the NICU at Hamot and thinking to myself, I'm gonna lose them both.
The teamwork that I saw that day is nothing like I've ever seen before. Between the paramedics and the trauma team, the neonatal team, and the obstetrical team, we all worked together to save her and to save that baby.
It was actually surprisingly quiet and calm, because everybody knew what they needed to do. And that certainly adds to the effectiveness in terms of the outcome.
The staff at UPMC Hamot here in Erie and the staff at Children's Hospital in Pittsburgh were phenomenal, and they made sure that things happened the way they needed to happen so that we could have the best possible outcome. I want ESTELLE to know Joanne was selfless, that she loved her more than anything out there. It would have been nice to have her enjoy what she created, because to hold her that first time and look at her it really completely touches your soul in a way you could have never imagined.
Sometimes when you have something right at home, you don't quite realize the full depth and breadth of what's there. You may not see it because it's right in front of you for so long.
I live here too. So do so many of the other people, so many of the other providers, and they want the best for their families, and they know what it looks like. The community deserves it. The community deserves the best.
If you read our mission, it's simply put, to serve. And the ability to serve and to serve better has been enhanced by working with UPMC.
UPMC Hamot and UPMC have learned from each other throughout this journey, and that's our strength.
We are the unmistakable leader in our region in regards to not only technology, but clinical quality of our staff, as well as the resource investment, and that you see every day around the campus. And there's no question that people are now taking note that Hamot is the leader.